Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Dietary sodium. Introduction. Dietary sodium is a mineral taken in from the natural food sources included in a person's diet. Sodium is more commonly known as salt. Your body needs some sodium to work properly. It helps with the function of nerves and muscles. It also helps to keep the right balance of fluids in your body. This program will help you better understand the importance of dietary sodium in the body and how you can make sure you are getting the right amount. Dietary sodium. Sodium is a mineral found in table salt and many processed foods. It is commonly known as salt. The body needs some sodium to work properly. Sodium is usually found in the fluids around the body's cells. The body's muscles and nerves need sodium to function properly. Muscles help the body move. Nerves are needed to carry sensations and movement orders between the brain and every body part. Sodium also helps keep the right balance of fluids in your body. Too much sodium can cause the body to retain or keep water. Your kidneys control how much sodium is in your body. If your kidneys can't get rid of extra sodium, it builds up in your blood. This can lead to high blood pressure. High blood pressure can lead to other health problems. Foods may have sodium added for many reasons. The most well-known reason to add sodium to foods is for flavor. Another reason sodium is added to foods is to preserve food and protect it from germs. Sodium can also be used to combine ingredients, improve color, and make food more solid. Sodium is an important nutrient, but the body only needs a small amount of sodium to stay healthy. Sources of sodium. Most foods naturally contain some sodium. The most common source of sodium is table salt. The technical name for table salt is sodium chloride. This is because sodium and chlorine are the two elements that make up table salt. Beets, celery, and milk are other natural sources of sodium. Water may also contain some sodium. Foods may have sodium added to them. Sodium is added to these foods in different forms. Condiments like soy sauce contain sodium. Processed meats and canned foods usually have sodium added to them as a preservative, but there are canned foods available that have low or reduced sodium. Most fast foods are very high in sodium. Be careful about how much sodium you get when you eat these foods. Some medications may contain sodium. Read the label of over-the-counter drugs to check sodium levels. Ask your healthcare provider or pharmacist if you are concerned about the amount of sodium in a medication.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Recommended amounts.
Not everyone agrees on the recommended daily limit. Some sources say healthy adults should take in no more than 2,300 milligrams of sodium each day. Others say cutting back to 2,000 milligrams or 1,500 milligrams is ideal. Most people eat more than 2,300 milligrams of sodium a day. A teaspoon of table salt contains 2,300 milligrams of sodium. That means that the majority of us need to cut back. You should also take in no more than 1,500 milligrams if you have high blood pressure, diabetes, chronic kidney disease.
Sodium deficiency is when a person doesn't get enough sodium. This is rare. In fact, most people take in more sodium than they need. This is especially true in countries where processed foods are common. Too much sodium is bad for your health. It can increase your blood pressure and your risk for a heart attack and stroke.
Children and teens also need to watch their sodium intake.
In general, teens age 14 and older should follow the guidelines for adults. For children, sodium intake is relative to the amount of food the child eats. The fewer calories a child needs, the less sodium they need as well. Using salt substitutes instead of regular table salt on food can help reduce sodium intake. Talk to your healthcare provider about salt substitutes. Too much sodium. Taking in more sodium than you need is usually not immediately harmful, but taking in too much sodium over time can be harmful to your health. Too much sodium can increase your blood pressure and your risk of a heart attack or stroke. Excess sodium may also cause the body to retain or keep large amounts of fluid. This is most common in people with congestive heart failure, cirrhosis, or kidney disease. People with these conditions should talk to their healthcare providers about a low-sodium diet.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Dietary sodium is a mineral taken in from the natural food sources included in a person's diet. Your body needs some sodium to work properly. The body's muscles and nerves need sodium to function properly. Sodium also helps to keep the right balance of fluids in your body. Excess sodium can build up in your blood and cause high blood pressure. Most foods naturally contain some sodium. The most common source of sodium is table salt. Foods may also have sodium added to them. Certain medications may even contain sodium. The daily recommended amount of sodium depends on the age and health of the person. Most healthy adults should not take in more than 2,300 milligrams of sodium each day. Most adults would benefit from a reduced sodium diet of no more than 1,500 milligrams each day. This lower amount can help prevent or reduce blood pressure and the health problems associated with it. Thank you for using Explain.